Eddie, you ready for a ball game Saturday?
I'm ready.
Good afternoon. Thank you for joining me for today's update. Before we get to the case report for the day, let me talk about the current situation with Hurricane Laura. As you know, that will be hitting the Gulf Coast in probably the next 24 hours. As that happens, we know that it will come into Arkansas and impact our state. We're expecting sustained high winds. We're expecting flooding. We're expecting, with the sustained winds, down trees, which means down power lines. And so with that, and in anticipation of that, I have issued a declaration declaring an emergency and allocating $250,000 of our emergency funds for preparation in order to get ready for what is anticipated with the flooding and the other damages that are likely to occur. And related to that, I have Director A.J. Gary here who will make comments in just a moment. But whenever you look at what we are to expect in South Arkansas particularly, you can be prepared to see flash flooding, sustained winds from 40 to 45 miles per hour. This means trees down. That means potential for power outages. The action that we're taking is to have our search and rescue teams on standby. We are also activating our Emergency Operations Center, which means they'll be acting on 2 current emergencies for the time being, but they will be prepared to respond as needed to the situation in South Arkansas. I've also talked to Governor John Bell Edwards, communicated with him, and offered our assistance in the event they need that in Louisiana, and I expect a request to come through in that regard within the next couple of days. In terms of my encouragement to the people of Arkansas is that Arkansans need to pay attention to the weather because you will know what the latest is, the time frame as to how Hurricane Laura comes into the Gulf Coast and the latest direction that it's heading. I might add that this could be where it actually enters the state of Arkansas as a tropical storm, which means it has high level of sustained winds, and that would raise the level of concern even to a higher level. Whenever you pay attention to the weather, do not drive around barricades. They're there for a reason. They want you to stop. They want you to turn around. They don't want you to drown. And so important to turn around with the barricades and watch for down power lines as well. I know everybody is paying attention. Arkansans have been through these things before, but we want to make sure everybody is prepared. We as a state are getting prepared, and with that, Director A.J. Gary, Director of our ADAM, has been working on this very diligently. Wanted A.J., if you'd come up and follow up with a comment.
Thank you, Governor. As the Governor said, that we know that Hurricane Laura will have an impact on the state of Arkansas. We are looking at heavy rainfall, which will result in flash flooding, high winds, as the Governor said, which will impact trees, power lines. We have been in constant contact with FEMA. FEMA is bringing up an incident team to assist us if needed, and they will be here tomorrow, so we will start working with them. The State Emergency Operations Center has been activated due to COVID, but we are increasing the number of personnel there so that we can better quickly respond to the needs across the state. Yesterday, ADAM, along with the National Weather Service and Dennis Kavanaugh with them, held a weather briefing with all of our county emergency managers around the state, just to make sure that we were all on the same page, that they knew that we were here to assist them. As the Governor said, the main thing that we're asking is for our citizens to be aware of the weather around them in their area, because the wind speeds will be determined by the path that the storm actually takes. So we can't say exactly where the worst part of the damage is going to be. So we're encouraging everybody to monitor their weather alerts, monitor their TV stations, their local weather, to make sure that they have all the information they need to better respond. As the governor said, we will, the Arkansas Urban Search and Rescue, which is made up of teams out of Northwest Arkansas and Central Arkansas, are prepared and standing by. However, I think we need to keep in mind that when we have winds of that magnitude, it may be times where they can't actually deploy because of the high wind, so that could have an impact. So please pay attention to the weather alerts, take precautions. If there's water on the roadways, turn around, find another route to go. Don't go through the water. Again, we're expecting some serious flash floodings through this event. So, Governor, thank you.
Thank you, AJ. And now on to our COVID-19 daily briefing. I welcome Dr. Jennifer Dillahay, who is here for the Department of Health. Secretary Romero is at a CDC meeting. We have Dr. Ivy Pfeffer here from the Department of Education. And with that, I do have one item of noteworthy news, and that is that I just had a report from Secretary Romero of the Department of Corrections that we have 0 COVID cases at Cummins, and we have 0 positive cases at the Ouachita River unit. And everyone knows how we've struggled with those 2 units particularly, and to have those clear with the inmates safe is reassuring, I'm sure, to everyone. In terms of our cases over the last 24 hours, we have an additional 649 COVID cases, 649 COVID cases. That brings us to 58,023. In terms of hospitalizations, we have a decline of 7 in hospitalizations. That brings us down to 435. And regretfully, in terms of our deaths, we have 21 additional deaths, which is a large number, and that brings us to 732. Testing, we tested 4,378, and I might add that that is the date of the result. And as we get to that slide, I want to make an additional comment there so that we can understand how that works. Active cases is 5,390. With that, let's go to the graphs. You can see that today's number of cases is too high. We want to get that down, and we liked yesterday better than today for sure. So hopefully that is a once-in-a-week incident, but we'll see. And then the graph that shows the downward trend still looks good, but if we have days like today, it's not going to look good. So we hope that improves. We have the number of active cases, which is good because we have a continued, well, fairly steady decline in those. We'll see where it goes tomorrow. And then the percent of positive tests. This, as you can see, we have a 8.4% cumulative positivity rate, but what's important is what we have in the last 2 weeks. We're below 10%, which has been acknowledged by the White House, but we hope that that will continue to be on the downward trend as well. And this just simply shows it in a graph or rolling average, 7-day rolling average graph that speaks for itself. And then this is what I wanted to remark on just for a second. This shows that we have 4,372 cases over the last 24 hours. But on our commercial labs, this reflects the date of test result. And so if it gets in the mail and we get it a day later, then that's added to that number because it's date of result. And so like yesterday, we had 3,300 tests. Well, now if you look back on yesterday, it's about 3,400 because we've had additional tests that have come in, and that's based upon the date of result. So we've emphasized that before, but just wanted to reiterate that. And with that, let me stop, and before I turn it over to Dr. Dillahay and then Dr. Pfeffer, who will come and speak about the schools, I did want to say on the schools that we have acquired 70,000 of these splash guard face shields, and they are being sent out to every school employee in every district in Arkansas, 70,000 of these. And this is another option for them to further protect themselves if they wish, and this would be used over the mask that would be underneath the shield. But I think many teachers will find this useful, and that will be sent out this week, and I thank the Department of Education for making this possible. With that, Dr. Dillahay.
Thank you, Governor. I wanted to start by expressing my thanks to my fellow Rotarians in the Clarksville Rotary Club for sending me this really cool mask for today. So as the Governor said, we had an increased number of new cases today. It was 649, and that brings our active cases to 5,390. Of those active cases, 258 are in nursing homes, 727 are in correctional facilities, and 4,405 are in the community. As the Governor mentioned, we had 21 deaths added to the total from the prior days, so we have a total of 732 deaths. These deaths that were reported, 6 of them are in nursing homes, but they weren't clustered to any particular nursing home. One of them was from the correctional facility, and overall there were several counties involved, no clustering, no more than 2 from each county in the deaths that were reported today. So it's a generalized phenomenon that we're seeing around the state. About 70% of our cases are in persons who are 65 and older for people who have died. We are pleased that we've had some increased testing for today. The results from yesterday are 4,372, and that gives us a total of 148,620 for August, and so our goal is 190,000, which would be about 6% of the population, so it's possible we might get there. We hope that we do. We really want to make sure that we do adequate testing in Arkansas to assure that we're identifying transmission in the cases that occur in our state. That's a very important strategy for stopping the transmission. Another important strategy for stopping the transmission, of course, is wearing cloth face coverings. So I wanted to take a few minutes today to talk about the best face masks to wear. So of course, the idea behind a face mask is when you wear it, it blocks the puffs of air that we give off when we talk or laugh or sing. This air has droplets in it. Some of them will fall to the ground, but there may be some aerosolization of very small particles of moisture with virus in it that stay in the air, and we want this mask to block it. So to do the best job, you need a mask that fits pretty closely around your face so you don't have a lot of leaks of puffs of air coming out from around the mask. Plus, you want something that is thick enough, 2 layers of material, so that the puffs of air don't make their way through the material. Right now, we want to emphasize that masks with valves are not acceptable. They do not meet the requirements of the directive. A valve, unfortunately, focuses a stream of air. So if you see someone with a valve on their face covering, you want to stand behind them. It's because that valve will allow those moisture particles to come through in a very focused way. Also, we've been asked about neck gaiters and bandanas, and they may not offer the protection we would like, so we're encouraging people to not wear them if at all possible. However, if you do wear them, double them up. Use 2 layers or 2 neck gaiters, or the bandana should be doubled. The second layer of material will offer added protection to keep from those puffs of air being expelled and making their way through the material. So I want to stop now and turn the podium back over to the governor. Dr. Pepper.
Thank you, Governor and Dr. Delahaye, and I'm pleased to get to be here today just to share a little bit of information. We continue to see evidence of positive starts to school from districts all around the state, and we're very thankful for that. We also realize that they're continuing to deal with uncertainties and challenges, and so today we want to talk a little bit about how the Department of Education is making sure that we're providing the leadership support and service to help districts in making decisions, to help our parents and our communities to feel confident in the decisions that are being made and in the safety for their children at school. So one thing that we have done is we have established points of contact for every superintendent in the state with members of our agency leadership team. So every superintendent has a person that they can call 24/7 in order to get questions answered, and we as a team then coordinate directly with the Department of Health. And it not only allows us to answer questions, it also is helping us to anticipate and to respond more timely when there are decisions that need to be made. In addition, we want to remind everyone about our resource call center. This call center was set up a few weeks ago, and today is actually day 18 of the operation of this resource call center. We have 23 team members at the Department of Education who are taking these calls, and these are subject matter expertise. They are also team members who are staying in communication with all of us so that we can make sure that parents, community members, educators, school administration have another avenue to call and get questions answered. And that's freeing up the Department of Health hotline so that they can deal directly with the school-related cases. So today, most of our calls have been from parents and grandparents. The calls have changed over the last few weeks. The last couple of days, we've had a lot of questions about technology, some about procedures in schools, just questions about schools opening or closing. And we've been able to answer those questions a lot of times from going to the different school district websites. Sometimes we put them in contact with the appropriate people at the school district. Sometimes we're able to point them to resources that we already have on our website or on the website at the Department of Health. And we're going to continue staffing this call center, so we really want to encourage everyone who has questions to reach out there. As noted in other press conferences, we want to reiterate that we are working with districts to provide PPE. We have sent PPE to 63 school districts across the state, and the contents of each of these deliveries has been very specific to what the school district has needed to supplement their existing supply. We will continue to keep our strategic reserve stocked so that we can meet needs as they change over time. And so far, it's been a really successful partnership. And as the governor mentioned, our next round of big deliveries are those face shields. So we've already started sending those out, and we'll continue doing that through the first of next week. And finally, I want to highlight a teacher, and I think that this is something that's very important because we know that education is a lot different than it was this time last year. And in order for us to provide the type of education that our students need, we have to really continue to think differently. And whether an educator is a first-year teacher or a seasoned administrator, one thing is certain, this is almost like a first year for everybody. And so we thought it was particularly fitting to highlight Brianna Davis. Brianna is now a second-year teacher. So she went through our novice teacher mentoring program a year ago, and she was asked as a second-year teacher to provide just a little bit of information and advice to all first-year teachers in the state. And instead of just giving some generic classroom advice, she wrote a letter. And this is featured on our webpage, but there were a couple of paragraphs that I found were so fitting, not only just for true first-year teachers, but for all educators who are a first-time COVID teacher, a first-time COVID superintendent, a first-time COVID principal. And so I'm going to read a couple of lines for her letter, and you can access it online. There is so much that you will not be prepared for, and that is okay. Keep believing in yourself and believing in the impact that you are making. You're not only a first-year teacher, but you're the first group of teachers that is tackling a challenge like the one 2020 has brought to us. What you are doing matters not just for today, but will matter years from now when that extra long chapter dedicated to 2020 is written in history books everywhere. We want to make sure that everyone knows and understands that you matter, your children matter, and we're going to continue working with schools to have a successful school year. So we are very appreciative of these examples and in the examples of many others. Thank you.
Thank you, Ivy, and thanks for sharing that letter. Tomorrow, we will have our outline, our presentation of how we're going to do our school district statistics in terms of any COVID positive cases in each district, in terms of cumulative and active cases. This would be for any district that has more than 5, which has been the standard that the Department of Health has utilized. But we'll go over that tomorrow. I think that'll be instructive and helpful for parents, and this will be, of course, posted on the Department of Health website. With that, we'll take any questions.
What have you seen so far in terms of districts having to make any modifications due to having cases?
Well, in terms of course, a number of them, a couple of them have had to respond to positive cases in their district, and they've followed the guidelines, communicated with the Department of Education and the Department of Health, and that's gone as smoothly as it can go. It's always disruptive, but they've handled it very well. Dr. Pfeffer, you want to comment on that?
So in terms of modifications to on-site operations, we've had only a couple of districts that would have really had to do anything that we would consider, I guess more aggressive. One of the districts simply delayed the start of school until today, and they have successfully started the school year. Heard from that superintendent this morning at Woodlawn, and so they readjusted their calendar to start today. The other school district has one of their facilities, KIPP, had one of their elementary schools, and due to the number of staff that have had to quarantine, they are now having to do remote instruction, but that will go through the period of quarantine, so we've worked with the Department of Health and them to establish an expected date of return. And that will be next week. Of course, if data or things change within that school environment, that create a situation, we'll continue to work with them and talk with them. But that's what's so powerful about establishing a point of contact for every school district. So that way superintendents are talking to someone at the Department of Education, and then we're able to get as much information with the Department of Health to help them make those decisions. The other school districts so far have had to just make some changes in terms of staff duties. We had a district today where we had 3 people from our Facilities and Transportation Division go on site to help because there were some custodial staff who were going to be out. So we're just taking the information, responding as we can, and trying to be as proactive as possible.
Sorry, did you say that the PPE sent to the 63 districts is from the strategic stockpile?
It is, yes.
So I think it was Friday, Secretary Key told us that every district had sufficient PPE, but doesn't that indicate that they don't, that they're already needing to dip into this emergency pile?
So the sufficient PPE was working with us to coordinate filling in wherever maybe the supply chain created some gaps for them.
So I guess what is the status of the stockpile?
We are continuing to add. This morning, I think we're getting a little bit low in our small bottles of hand sanitizer, but we have additional hand sanitizer ordered. And this is going to be an ongoing changing process for the next several months. And again, it's the regular communication, it's the data, and looking at all those factors and making good decisions.
Thank you. Any other questions?
I guess for the Department of Health, the CDC came out with some new guidelines saying they don't recommend testing asymptomatic contacts of cases. I was wondering if the department agrees with that, if that will change anything that the department's doing.
I'll let Dr. Dillahay comment, but in short, we're aware of the CDC changing guidelines. I've discussed that with Dr. Romero. We believe our testing is sufficient, that we want to continue to test anyone that fits within the right criteria that wants a test, even though they might be asymptomatic. And so we're going to go a little bit further than that CDC guideline. Did you have anything else to add to that?
Would you recommend if somebody is exposed but asymptomatic that they get tested?
Yes, absolutely. I think that's important. That's the safest route to take. You know, if somebody has traveled, they're worried about where they traveled, they're asymptomatic, go get a test because that could protect your loved ones or somebody that you might be going to school with or your team. And so that is a good precaution, and it's helpful for us to know exactly what's out there. Leslie?
I got kind of lost in the testing details. The 649 cases that were reported today, did they come from the 3,478 tests reported, or from the 4,372? Or did I mishear you the first time when you said that there had been 3,478?
A test? Well, I'll get my numbers here.
I may have spoken when I gave the governor number. What I have is 4,372 tests.
Yes, and that's what I have written down. So, yes. Yeah, so there are 4,372 tests done in the last 24 hours, and of that we have 649 cases. Yes.
Now that the Cummins and Washita River unit do not have any positive cases, are you considering opening up visitation or any plans to, not have those positive cases come up again?
That is a heartache, just like anybody who wants to visit a loved one wherever they might be. And the prisoners, the inmates need that visitation. So I'll continue to have a dialogue about it, but that really raises the level of risk within the institution. I don't expect that to be changed for that reason, because right now we have staff that come in out of the community, and that's one level of risk that you have to have. But to add another level of risk if visitors were coming in and out, and there's a lot of visitors that go in and out, that really would allow the opportunity to expose inmates once again to the virus. And so we want to avoid that, so I don't see that happening in the near future, but we'll continue to look at options to make that a better environment.
So you don't see a future plan similar to the reopening of visitations to nursing homes?
Not at this time. Not at this time. It does merit more discussion. I think if there's ways that we can make remote visitation and other things more accessible, I think that's good. If we can reinstate visitation with some standards, we'll look at that, but we do not have that right now in the works, and we don't know of a way to do it right now. Is there anything remotely?
Yes, Governor. This is with KNWA in Fayetteville. We know that FEMA approved the lost wages grant for Arkansas, so I was wondering where that stands for the natural state, because I know the last time you had spoke on it in one of your press conference, you had mentioned that the legislature still needed to give approval for that. So have they given approval, and where do we go from here?
Yes, the legislature has given approval, and so the only thing that remains is getting the system changed so that those checks can go out, that increased level of compensation. Once again, is going to take some time to do that. Hope to have Secretary Preston here at some point to go a higher level of detail, but people should not expect that within the next 2 weeks. It's going to take a while to make those changes and to be able to adjust it and get that out. We have a very old, antiquated unemployment IT system that's going to take some manual changes in order to get that done, and we're still waiting for additional guidance from the federal government. So the word is be patient for now, and we'll hope to have more information in the future.
Governor, this is Andrew with AP. Wanted to ask you, looking ahead to this weekend with the Salt Bowl, wanted to ask you how confident are you that an event of this size, potentially 12,000 people, could be carried out safely, during the pandemic, and what role, if any, is the health department going to be playing in terms of monitoring this for compliance? And are you looking at this as kind of a way to judge how to handle or whether there should be more large events in the future during the pandemic?
Well, we learn from every event, and if one doesn't work, we have to adjust to make sure that we do it better the next time, or we adjust our restrictions. In terms of the Salt Bowl, they have submitted a plan to the Department of Health that they review to make sure that it meets our guidelines and that they have the compliance requirements in there. And so that has been reviewed. I know that the attendance will be different this year, but with looking at the size of War Memorial Stadium, social distancing should not be a problem. And then they're offering it on pay-per-view, so that will relieve some of the crowd pressure as well. So there's, I will actually be there myself, so I'll do my own monitoring as well during that time and during that game. But I hope they have a very successful game, and I know that they will be concentrating from the coaches to the team and hopefully to the parents and everyone else to have a very safe Salt Bowl. Next question.
Governor Mike McNeil at MagnoliaReporter.com. Anticipating that there is going to be fairly massive storm damage in South Arkansas as a result of Laura, what plans have been made to create emergency shelters that also respect COVID guidelines?
Well, at this time, we're not aware of any mass evacuation that would require the shelters but as they are set up, we will have to keep COVID in mind if that is necessary. The other thing would be what happens in Louisiana that might impact us in South Arkansas, that if they if they utilize the hotels, they need additional space. If we have to do emergency shelters, then I'll be coordinating with Governor Edwards in Louisiana to make sure that we can be a good partner and a good neighbor. But at this point, we will monitor the situation. AJ, did you have anything else on that? Let me, AJ Gary, Director Gary might have a comment there.
Yeah, thank you, Governor. Not much to add to that, but we'll be looking at non-contingent shelters. So using the hotels, using things like that would be our first choice. But we are ready to work with the health department. We've had these discussions before and work out whatever we need to do.
Thank you, Mike. Next question. With that, I think
Governor, I'm sorry. I was just waiting to be polite. It's Neil Gladner in Hot Springs. To take you back to the unemployment question, based on some other states who have said that when they get it, it's only 5 or 6 weeks worth of aid. Can you set some expectations in terms of once the money starts flowing that people shouldn't expect it until for it to continue for months and months?
So what's your question?
Once the federal money starts to flow, once the computer glitches get fixed, how many weeks worth of that $300 a week do you expect there will be?
Oh, thank you. I understand now. And there is a limit. The FEMA pool of money, I can't remember what it is nationally, but it is not an unending stream of money. I do not have the exact number of weeks that it might. I'm not sure they know specifically, because that depends upon not just Arkansas's demand, but the number of unemployed in California or New York is all a part of that same pool, and it depends upon how many states access those funds and how quickly they do. So it will be a determinate amount of time, but we don't have the specific date that might end. I do believe it will be. The design is that it will be able to extend long enough until Congress can act, because that's something that hopefully they'll be able to address for a longer period of time, but I'm sure there'll be limitations on that as well. Thank you, Neil. And we hope to have more information on that in the coming days, maybe not tomorrow, but in the coming days. Thank you very much.